My presentation is on inflammatory diseases of the renals. Although there are many diseases that can cause the kidneys to become inflamed, I'll be talking about two of those, and that is acute glomerulonephritis and lupus nephritis. But first I'm going to go over a little normal anatomy to refresh everybody's memories. The kidneys are located in the retroperitoneal cavity, lined against deep muscles in the back, and are protected by the ribs. The kidneys have a bean-shaped structure and measure about 9 to 12 centimeters in length, 5 centimeters wide, and 2.5 centimeters thick. The right kidney is usually located slightly inferior than the left kidney because of the overlying liver. The kidneys are supplied with blood via the main renal arteries, which branch off of the aorta. From there, the main renal arteries will divide at the hilum of the kidney into the segmental arteries, which will then further divide into the interlobar arteries, and from there the arcuate arteries. And I included two normal ultrasound images of the kidneys. This one is in the longitudinal plane, and you can really tell the bean-shaped structure right here and the overlying liver, so we know that that is the right kidney. And here's a transverse image of the kidney. The first disease I'll go over is acute glomerulonephritis. This is caused by an inflammation of the glomeruli in the renals. The glomeruli is a group of capillaries in the renal corpuscle that blood travels in and out of via the afferent and efferent arterioles. Acute glomerulonephritis affects the kidneys at a functional level and can affect both kidneys at the same time. When this occurs, the vascular elements are secondarily affected, but the kidneys become enlarged and poorly functioning. It will most likely cause dangerous levels of fluid, electrolytes, and waste to build up in the body. Some signs and symptoms of this disease include hypertension, which is high blood pressure, anemia, which is when the red blood cell count is lower than normal, and peripheral edema, which is an accumulation of fluid that causes swelling in the extremities. It can lead to severe acute heart failure or chronic kidney disease. Under ultrasound, acute glomerulonephritis presents with an increased renal parenchyma echoes. And I included this image of the kidney under ultrasound, and it shows the increased parenchymal echoes. Shows that it's slightly more echogenic than the normal kidney. The treatment choice for this disease is usually dialysis, but sometimes the patient may be treated for high blood pressure if it's called early. The next disease that I'll go over is lupus nephritis. It is an autoimmune disorder associated with lupus erythematosus, which affects the body in many different ways. Lupus erythematosus can affect many organs in the body, but in 50% of cases it affects the kidneys. Lupus nephritis is most commonly found in women between the ages of 20 and 40 years of age. A few signs and symptoms of lupus nephritis are hypertension, which is high blood pressure, hematuria, which is blood in the urine, proteinuria, which is protein in the urine, renal vein thrombosis, and renal insufficiency. Because of the renal vein thrombosis, there may be an absent flow in the renal vein. On ultrasound, it appears to show increased cortical echogenicity and renal atrophy. And I included this ultrasound image of the longitudinal kidney to show that the echoes in the kidney are significantly more echogenic than in the normal kidney. And that is what you'll typically find on ultrasound of the lupus nephritis. The most serious complication of lupus nephritis is kidney failure. Dialysis is usually the choice of treatment, but most patients will eventually need a kidney transplant to fully correct for lupus nephritis. And I included my sources, which are Hagen Ansart Volume 1, Healthline.com, and MayoClinic.org. Thank you.